Hello everybody, my name is Danny Gilmore, and today I'm going to talk about fall reduction in adult healthcare settings. So being on a orthopedic med-surg unit, falls are a major issue. They're a major issue in any type of healthcare, but specifically orthopedic nursing, because people are typically there for falls in the first place. On my unit that I work on, we've had an increase in falls over the last 3 months. Started out with 5 falls in April, 5 falls in May, and so far in June we've had 5 falls, and the month's not even over yet. So what is this attributed to? Well, I can tell you when I looked into the information that we were doing a Morse scoring as shift report, and before this 3-month period we were having less falls, about 20% less. And I noticed also that we stopped utilizing the camera a lot. A lot of nurses were reluctant to use it because there's paperwork involved. You have to call the telemetry department, which takes care of the camera, and there's just certain things you have to go through, and it kind of slows your shift down. So I just assume that's why it's not being utilized. That's from my own experience as well. So our target audience for this assessment is going to be nurses and patients, patients and physicians, nurses and patients' families, and also hospital leadership, nurses' aides, and then also executive leadership and unit leadership. So our community assessment is going to be a risk for falls. Now, risk for falls is a nursing diagnosis, but it's also a community health diagnosis, because falls are the leading cause of injury and accidental death among individuals older than 65, and the injuries sustained from such falls are hip fractures, spine fractures, and wrist fractures. And they also lead to lengthening hospitalizations for the elderly and reduced quality of life for elderly people. The literature review I came up with was how video monitoring can decrease falls and improve patient safety, and also decrease sitter use in the hospital, which saves the hospital money, and improves patient and family satisfaction. That was from Corden M 2018. And also Morse scoring. Factors identified that reduce fall risk using Morse fall scale. That was Borakova et al. 2018. And then I used Hempel S et al. For adherence and intervention components and comparison group information that reduce the risks of falls. The literature. So our plan is to reduce falls, and we're going to reduce falls by handing off that Morse score at the shift change, and also utilizing video monitoring if the Morse score is above 45. The literature review I came up with was how video monitoring can decrease falls. So the way we evaluate whether the interventions helped or not is a monthly fall inventory. HCAHPS, which is Hospital Consumer Assessment and Healthcare Providers and System Score, employee surveys, and also during shift huddle, we'll find out information about falls at that point. So in conclusion, my mentor for this project recommended just purposeful hourly rounding as being the best way to reduce falls. But when I look back on the information in my own experience, that Morse score on shift change changed the dynamic of care for that night. So in my opinion, that was the most beneficial way to reduce falls, and also video monitoring. Because going way back before I started at a big hospital, I was at a rural hospital, and they didn't have any cameras. They utilized the Morse score on shift report, and that change at that hospital, I noticed a significant decrease in falls. They also didn't have sitters at that hospital, so just that Morse score on shift report was big, and that did a lot. So I think adding that and then video monitoring is the best way to reduce falls. So often, in healthcare, there's funds and staffing limitations, so that can also be a fall risk. So more scoring, and the fact if you're in a hospital with video monitoring, utilize that, because that'll save in the long run and reduce falls. Thank you. So in conclusion,